Malnutrition is a common and serious condition affecting about 5% of the population, and in England it's costing a staggering £19.6 billion, costs that are only going to rise as the population ages and costs for social and health care go up as well. Approximately 1/3 of patients admitted to hospital are already undernourished, and they stay in hospital longer. The cost of treating malnourished patients is 2 to 3 times more, draining the NHS and social care budgets of vital resources. I've come to Southampton General Hospital to meet Dr. Mike Stroud. He's one of the UK's leading experts in clinical nutrition.
Well, I think most people don't appreciate the scale of malnutrition in a modern country like the UK. There are enormous numbers of people malnourished, probably around 3 million. I think there's a striking lack of awareness of the scale of the malnutritional problem amongst individuals out in the community and in the care homes and in the hospitals. And healthcare professionals in general just do not appreciate how important it is and how much difference they can actually make if they address it. In hospital care settings, you're talking about improvements in complication rates, for example after surgery, of around 40%. In hospital settings you're talking about declines in mortality of around 30%. This is an enormously effective treatment.
Dr. Stroud believes that health and social care commissioners may hold the key to delivering optimal nutrition in care settings, and now a commissioning guidance document has been produced to support commissioners in their decision making.
So this can only happen if people, the commissioners of the services, actually absolutely recognise that this is important.
It's a view strongly shared by Northern England's Chief Nursing Officer, Margaret Kitching.
Without changing mindsets, changing culture and changing professional behaviours around this, then it won't work. For me, it's around how do we get the spread of this good practice and the education, training and commitment from the services, from the commissioners of the services, who in effect are dictating what the specifications are. What are we buying, if you like, from our provider services? They need the expertise to understand best practice as well.
The size of the malnutrition epidemic has exploded, leaving Britain's relatively small number of dietitians dealing with this problem on the front line. Chair of the Parenteral and Enteral nutrition group of the British Dietetic Association, Anne Holdoway, wants to encourage all health and social care professionals across the community to take responsibility for providing better nutritional care.
If we appreciate that 3 million people are at risk of malnutrition or have malnutrition, and that many other patients and clients in care homes and care settings are also facing nutritional difficulties, the number of dietitians we have in the UK cannot tackle the issue alone. I think it's important to recognise that we have skills that we can offer to patients who need complex management, but in other ways we should support other carers and healthcare professionals to deliver the first line dietary advice that can begin to deal with some of the issues that our patients are facing.
Hospital trust boards tasked with setting healthcare strategy are often unaware of the extent of this problem for those on the front line, something consultant Dr. Trevor Smith at Southampton General Hospital believes must change.
There isn't often a system-wide approach to delivering that in a secure way, and trust boards in particular, I think, probably haven't properly understood how important nutritional care is as a fundamental element of the overall patient pathway in hospitals. Trust boards need to understand that nutritional care doesn't cost money, it ultimately saves money. But it does need a dynamic and forward-thinking trust board that will take that first step, that first risk, if you like. The risk is tiny in my view, but the dividends are enormous. We know that providing nutritional care has significant benefits in terms of reducing length of stay, reducing serious complication and reducing mortality rates in hospital.
A report by the National Institute for Health Research and BAPEN outlines the potential cost avoidance to health budgets if nutritional care improves. Right now, billions of pounds in savings are available to health and social care budgets.
The savings are immense if we deliver good quality nutritional care. BAPEN, working with the NIHR, have just published a health economics analysis, and the good news is that local CCGs are able to calculate the cost saving for their health economy.
BAPEN's chair of their Quality and Safety Committee, Dr. Ailsa Brotherton, is focusing on understanding how we create the right culture for continuous improvement.
For me, this is about creating the right culture to deliver good nutritional care. So I'm hoping that over time we can work together, we can bring together multidisciplinary teams, and we are starting to see a culture change. What we're starting to understand is how we need to tackle the problem differently. In the short term, I think I would like to see a standardisation of good nutritional care. So let's eliminate all unnecessary variation and rapidly spread the best practice that we've got.
In the past, measuring standards of nutritional care was difficult, but now a clinically validated care tool designed by experts and clinicians to be used across different settings is starting to deliver valuable data.
We went through a pretty rigorous iterative development with a group of dietitians, gastroenterologists. The tool itself is a web-based tool, so it's accessible. You have to register for it, register your organisation, and then it is literally very simply a follow the process data entry form, save your data, and then instantly that information is presented back in really simple graphics, looking at change over time.
BAPEN's nutritional care tool is designed to build a bank of evidence to help organisations evaluate the quality of their nutritional care. Head of Transformation Analytics Kate Cheema is excited about the data the tool is now gathering.
Data provides us with the absolute intelligence to be able to move our improvement efforts forward. We've got some great examples of where this data has been used proactively, and it's fantastic to see the really clear line of sight between the technology, the data, the geeky stuff, and the delivery of high quality care on the ground.
So progress with this complex challenge is slowly being made, but some experts want to see the pace of that change accelerate.
Everyone needs to realise that it's their responsibility that this big problem is tackled properly. After the Berwick report, where it was quite clear that there were big failings in this area of care, BAPEN and other organisations produced this Malnutrition Matters Commitment to Act. So it outlines 3 things that every level needs to accomplish, from government through to patients, to actually make it happen.